Hi everyone, it's Dr. Cary. I'm a chiropractor here in Kelowna, British Columbia, and thank you for joining me today for Coffee with Dr. Cary. This is a segment I like to do on Saturdays or Sundays here in my office, and just want to bring you up to date on what we've been working on in the clinic, how our week went, some of the events we had, and then look forward to the week ahead. And it was a really great week in the clinic because we were able to see a lot of patients. We are accepting new patients as well. So it was nice to be able to see some new patients. And we saw a variety of different conditions. We saw people with neck and back issues, some people with ribs and mid-spine, people with car accidents and whiplash, people with TMJ, jaw issues, shoulders. So we basically see all types of spinal and joint conditions in the clinic, and our goal is to help the person to reduce their pain, improve their mobility, correct their posture, and maximize their health. And so we're in this 100-day cycle here on social media where we're encouraging people to take some action to improve in these areas. And we're just crossed the 40-day mark in this 100-day cycle, and we continue to post and talk about the days and what we're working on and different things you can do to help yourself. This week I read from my book called Neck Pain. It was published on Amazon, and it's in 3 different formats. It's in audiobook, ebook, and paperback. I read from the introduction, and today I wanted to read from chapter 4, which is causes of neck pain. So I'll just read a little bit, and then I'll get into the upcoming events and promotion we have in the clinic for new patients right now. So chapter 4, causes of neck pain. Most people come to see me after weeks or months of neck pain, and it's often not their first occurrence. We call neck pain that's long-standing chronic in the clinic versus acute or subacute, which is more recent. We know the longer the neck pain has been there and the more reoccurrences, the harder it is to treat, because the spine and joints start to break down and wear out. This process is called degeneration, arthritis, or more specifically, osteoarthritis. When I first meet a person and I do their history, exam, and testing, I want to arrive at a diagnosis for their condition. The diagnosis describes the patient's condition and the structures that are involved. Some common diagnoses in the clinic involve spinal sprain, strain, cephalgia, spondylolisthesis, herniated disc, torticollis, carpal tunnel, concussion, stenosis, thoracic outlet syndrome, just to name a few. So in the book, we talk about different types of conditions we see in the clinic. The main focus is on neck pain, whiplash, headaches, and concussions. So if you have any of those conditions, I recommend that you can go to Amazon and get the book there. We also have a PDF copy of the book on our website. I'll show you that in a second. So I'm just going to switch over to our website. So just bear with me while I do that. And let's see if I can get that up. Okay, bear with me for a sec, you guys. Okay, I think I can get that. So here we are. So this is from one of my blog posts this week, and we're talking about booking an appointment. And if you do, right now you can get $15 off your new patient appointment by using code 15OFF. And it's really easy to do that. This is our website. If you go to drcaryyourq.com and then you click on these 3 dashes, all you have to do is go down to appointments. And when you go to appointments, you enter your information right here. So if you click on book now, and we did have a patient come in. This is a brand new page and a brand new feature for us. We did have someone come in this week with hip pain and use the website to book the appointment. So let's say you wanted to book an appointment on Tuesday. You'd click on that, you'd pick a time, and then you'd click on next right here. You would enter your information, which includes your first and last name. And then what you would do is you would enter your email address, your phone number. The system will send you a text reminder if you check off this box before the appointment. And then the reason for your appointment and the coupon code. And that's where you'd put in 15 off. You could also apply that right here, add a promo code, and write 15 off right here, and that will take it off the total cost of the visit. So that's pretty easy to do. And while we're here, I wanted to show you the upcoming events. So our upcoming events, they're all free of charge in the next 2 weeks. So if you go over here, you see shoulder pain, how can it be helped? That's going to be on Tuesday. So if you have shoulder pain, rotator cuff, have had a shoulder injury, this is a good webinar for you. If you go to the following week on Tuesday, we're going to have a webinar on foot pain. And so how do we help people with foot pain, sprains and strains, plantar fasciitis, heel spurs, bunions, proper footwear. We're going to be talking about all that, orthotics for pronation and supination. On the 5th of May, we're going to talk about having a rounded back. So if you have poor posture, you know somebody who has a rounded back, we're going to be talking about what you can do to correct this. And we call this a hyperkyphosis, meaning an arched back, an increased kyphosis, which is a forward curvature. So we're going to talk about what we can do to help that, and then what you can do to help yourself. And then we're going to do another Coffee with Dr. Cary segment on May 8th. So please join us for that. Get tickets by clicking on these boxes right here. You just enter your info. The system will send you a ticket, and then you can join us and ask questions. The benefit of it is you can type in the chat and ask us questions. So that's great. And then if you go over here to the shop function on our website, what you're going to see is the books that I've published. And if you wanted to get a copy of neck pain, you would just click on this down arrow right here. And then what it'll do is it'll add it to your cart. And then you can go ahead and purchase that. And you'll be able to download the PDF version of the book. So that's pretty easy to do. We do have a book on back pain as well. And then the 100-day diet, which is how I lost 30 pounds in 100 days. So I wrote about that in this book. And what else did I want to tell you guys about? So you know the upcoming webinars, the webinars that we've already posted are either on our podcast or our YouTube channel. If you click on the YouTube icon, it's going to take you over here to our channel. And on the YouTube channel, you're going to see all the uploaded webinars, including this one, where you'll be able to watch some of these webinars. And so that's a great place to go and subscribe by clicking this button right here. And you'll see our recorded webinars. We do have a podcast channel as well. So our podcast channel is called Super Healthy, and that's on Android and Apple and Spotify. So you can subscribe to that channel as well. You'll get the audio version of this. And I just want to remind you guys that this week coming up, we do have some appointments available, and that's going to be throughout the week. You can go right to our website to see what's available. And we are accepting new patients in the clinic. The benefit of coming to the clinic is that we bill directly to insurance, including third party and ICBC car insurance. No referrals needed, so you don't need a doctor referral. And our care is safe, gentle, and effective. We use hands-on traditional techniques and instruments to do adjustments, so more contemporary techniques. We have digital x-rays in the clinic, and we use shockwave and laser for soft tissue. So we have the newest technology and methods that we use to help people. And we do have appointments available 7 days a week on most weeks, and we're open until 7 p.m. on Tuesdays and Thursdays. So lots of availability for new patients, and we can usually see a new patient within 48 hours. So feel free to contact us, and I look forward to seeing you at the upcoming webinars this week, as well as at the clinic if you're in the Kelowna area.